now.
Good evening. Beginning this Tuesday with more on a big push for mental health among the youth. Officials say SB 224 is a new law that requires schools in California to incorporate mental health education into their curriculum. 23 ABC's Vanya Patino spoke with a child psychologist about why this is needed now more than ever, and with the Kern County Superintendent of Schools office about how the rollout will work. She joins us live from downtown Bakersfield now with the details. Vanya.
Good evening, Keely. Well, the education courses will be taught once during elementary school, once during middle school, and once during high school. Now, the bill did go into effect this year, but schools have 2 years, so until 2024, to fully implement their plan. Here in Kern County, most schools are still in the early stages.
Each kind of school level, elementary, middle school, and high school will look totally different. And I think some of it will be kind of health-based in health classes. So if they're teaching health class, they can incorporate the mental health education in there.
And while school districts are still in the early planning stages of incorporating a mental health curriculum, Jeffrey Coggin, the program supervisor for prevention services at Kern County Superintendent of School Office, says they are on standby for guidance coming from the California Department of Education to see if they will provide framework or leave it to each district. For now, the course will only be taught every school level from elementary to high school due to logistics.
I don't know if that's enough, but I think kind of their idea is they don't have a health class. They're gonna have to find another way to fit that in the curriculum. So that's gonna be a lot of time too. But I think at a good starting point, one per kind of school level is great.
Coggins stressed they are excited to start rolling this out as the impacts of the pandemic have been very obvious in students here in Kern County.
Some attendance has been an issue where attendance rates have been going up and down just because of students, with grief and having trouble going to school. So there's been lots of issues.
That is something pediatric psychologist at Valley Children's Hospital, Dr. Amanda Suplee, has also seen in her patients.
Stress that's manifesting itself as physical symptoms, so a lot more like abdominal pain or headaches. And we're also seeing a significant increase in suicidal ideation and suicide attempts in our emergency room.
Dr. Suplee says starting that conversation in a school setting will make an impact later in the child's life and also help fight the taboo that exists among mental health for future generations.
It'll give them the vocabulary to describe how they're feeling, but it also gives them the strategies. Say okay, I'm starting to feel this way. I know that must mean I feel sad. This is what I can do to take care of myself. And I'm hoping that having those conversations earlier will help address some of those issues.
And again, SB 224 does not go into effect until 2024, but Dr. Suplee says she hopes this opens a door for more resources to be made available to families who would otherwise not have access to mental health services. Live in downtown Bakersfield, Vanya Patino, 23 ABC News, connecting you.